So welcome back guys to this channel, Clinch the Diagnosis, and we are back here after a long gap, I guess of 3 weeks. We haven't uploaded any videos for the last 3 weeks, and the last video which was uploaded was a question on liver cirrhosis. So yes, today will be the explanation video of liver cirrhosis, but before that I would like to thank each one of you for constantly supporting this channel and motivating me to keep making videos. And from here onwards we'll keep this channel very regular and we'll be uploading videos regularly. So before getting ahead with this video, I would like to make an announcement that we are soon coming up with complete practical content, as in examination of various systems like CNS, RS and everything. So I think now we have our practical exam, so just before that we are planning to come up with this content. I hope you all will like it, you all will watch it, and it will be of great help. So yes, now let's proceed ahead and see why this is liver cirrhosis and what is liver cirrhosis and everything about liver cirrhosis. So let us have a look at the pathophysiology of liver cirrhosis, and we'll understand how various insulting agents lead to hepatocyte damage and then the sequence of events which end up in liver cirrhosis. Let's have a watch. So let us see what transforms a normal liver into a cirrhotic liver. So on a microscopic section you will see hepatocytes, and below these hepatocytes will be the stellate cells. These stellate cells are also called as cells of Ito, and these are the blood sinusoids through which the blood flows. Now these are the sinusoids. Now various insulting agents like viruses or chronic diseases like Wilson or autoimmune hepatitis and alcohol, the most important, these hepatocytes release cytokines, and the cytokines stimulate these stellate cells. So now these stellate cells, which originally store vitamin A, would transform themselves into a myofibroblast-like cell. So a myofibroblast-like cell is produced, which will now produce collagen. So this collagen now starts to accumulate around the stellate cells, and with time, depending on the degree of insult, the amount of collagen will be produced. So as you can see here, as the amount of collagen goes on increasing, this collagenous substance starts to compress on the blood sinusoid, so the blood sinusoid is now compressed, which will lead to increase in the sinusoidal pressure. This compression has led to increase in the sinusoidal pressure, and this sinusoidal pressure will get transferred back and will contribute to portal hypertension. So now, as we've seen the pathophysiology, let us see how a patient of liver cirrhosis would present. Would he always be symptomatic? No, he might not be symptomatic. So what would be the symptoms if he is symptomatic? So like any chronic condition, he would have anorexia, he would have weight loss, and in general fatigue. So what about those ascites and the other symptoms? So yes, those symptoms would come when it is a decompensated liver disease. Until and unless it is compensated, these symptoms would not present. So compensated liver disease would present with symptoms, as I said, fatigue, anorexia, and a decompensated would present with hepatic encephalopathy or ascites or portal hypertension and the other consequences. So as we've seen how would the patient present. Now let us see what is the condition of the liver in liver cirrhosis. So is the liver enlarged or is it shrunken? Yes, in early disease it is palpable, it is enlarged, but in advanced cirrhosis it is shrunken. So is the liver always shrunken? No, there are two conditions in which the liver can be palpable till the end in case of cirrhosis, and one of them is alcoholic liver disease, and the other condition in which the liver is shrunken is hemochromatosis. So we've seen how the patient is presenting, we've seen the condition of the liver. The liver in general is of firm consistency and would have nodules. So everyone of us heard about macronodular and micronodular and mixed cirrhosis. So these nodules can be palpable. So after this, let us see what those images which were posted, what do they mean and the reason of their presentation. Okay, so the question was about a 60-year-old male who is an alcoholic since 25 years. So he has presented with these symptoms. So let us see how bad is alcohol and what its chronic consumption can do to our body. So first image here we have is of this distended abdomen. This distended abdomen, see, this is called ascites. So everyone has learned what are the various differential diagnoses for a distended abdomen: fetus, flatus, feces, fluid, and more are there. So now let's go ahead. This is ascites, and when would a patient of cirrhosis develop ascites? A patient would develop when he has portal hypertension? No, he would develop only when he has a decompensated liver disease. Portal hypertension can exist without ascites. Not necessary that every case of portal hypertension would have ascites, but every case of decompensated liver disease, yes, would have ascites. So What is the cause of this ascites? So there are mainly two causes. So one, as we saw in the pathophysiology, what was happening was the sinusoids were getting compressed. So now what happens is, if you look at the anatomy, so have a look at this, the superior mesenteric vein and the splenic vein, they join to form the portal vein. This portal vein enters the liver and then it divides into various sinusoids, and then hepatic vein carries the blood away from the liver. Yeah, so what will happen if there is collagen tissue, there are regenerative nodules which are pressing upon these sinusoids. So these sinusoids would not let the blood flow towards the hepatic vein, and the blood will start to accumulate in the portal vein. So the pressure in the portal vein would increase, and this is what you call as portal hypertension. What is one other reason of portal hypertension? Okay, so now after seeing this one mechanism of how ascites is produced, let us see the other mechanism, which is actually a more important and a major one. So what is happening is, in case of a cirrhosed liver where it is decompensated, there is elaboration of vasodilators which leads to splanchnic vasodilation. So most of the blood is accumulated in the splanchnic system, so the effective circulating blood in the blood vessels comes down, and this also leads to a reduction in the supply of the blood to the renal system. Kidney is also deprived of blood. So what happens when the kidney is deprived of blood? So the GFR will decrease. What comes into picture when the GFR is decreased? The RAS system comes into picture. What will this RAS system do? It will end up in the production of aldosterone. What does aldosterone do? All of us know it is responsible for absorption of salt and water. So what will happen if salt and water is absorbed? The blood volume is again increased. So this blood volume increase is also seen in the portal system. This will again lead to increase in the portal pressure, and the fluid will leak out of the vessels, leading to ascites. So this is the second mechanism of ascites. Okay, so after seeing the mechanism of ascites, let us jump to the next images. What are the next images here? See, there are two images here. So one of them is spider nevi, where you see a central arteriole and its branches, and one is this image showing palmar erythema. So both these findings are believed to occur due to high estrogen levels in a patient of liver cirrhosis. Why is the estrogen level high? Because see, obviously the liver is not working, and estrogen normally is converted into its inactive metabolites. So now a cirrhosed liver would obviously not do that. Second, what is happening is androstenedione is not metabolized because of cirrhosed liver. So androstenedione will get converted to estrogen. So due to these reasons, the level of estrogen is high, and these two findings are believed to be due to estrogen. So the last finding which we have is this. We see a contracture in the hand which we call as Dupuytren's contracture, and this is actually because of fibrotic condition affecting the palmar fascia, and no reason is known actually what causes Dupuytren's contracture in case of a liver disease, but it is more specific for an alcoholic liver disease. So it is believed that there are some changes in the local circulation there, and release of prostaglandins which lead to chronic hypoxia and ischemia of the palmar fascia. So it undergoes fibrosis and hence contracture. So this leads to Dupuytren's contracture is what is a proposed mechanism, but it is not very sure as to this mechanism is responsible for Dupuytren's contracture. So I guess we've seen liver cirrhosis, we've understood what is actually happening and what is going wrong with the liver and the portal circulation and why is ascites occurring. So at the end, I would like to say, if you all have not understood anything, you can again watch the video. I think the pathomechanism is clear enough to understand what is actually happening. So stay tuned. As I said in the starting, that we are going to come ahead with new practical content, examination of various systems. So stay tuned, it will be of great help again, and thanks a lot for all those who are supporting. And if you're actually liking it, please consider subscribing to this channel, so we'll come up with great content ahead. Thank you.